Why are neurodiverse youth disproportionately targeted by LGBT ideologies? So we had a session with Professor Carolyn Peeler this morning on this topic, why people with autism spectrum disorder tend to be more vulnerable to gender dysphoria. There's some theories. I think a big part of it is someone with autism spectrum disorder or neurodiversity, typically they struggle with social interactions, social communication, social relationships, and also they can have very rigid thinking around, for example, gender roles or sex roles. So someone with autism spectrum disorder, you can imagine, might struggle to feel comfortable in their gender role socially, might struggle with general acceptance with peers, and they might have very rigid thinking and expectations about how one should feel as a male or a female, which might make them more vulnerable. I do also think, apart from the social and relationship difficulties, youth with autism spectrum disorder or neurodiversity might spend more time online and be more influenceable on online groups. And so I think these factors are part of why neurodiverse youth might be more susceptible to LGBT messaging, also easily influenced around identity and rigid thinking about that. What are your recommendations for someone who might want to go into private practice? I'm about to go into private psychiatric practice, God willing. I think the first thing is obviously you need to know what are the legal requirements and the professional requirements for you being able to practice as a private practitioner. So you need to be qualified and registered. Also, you need to be aware of the legal and the ethical guidelines and boundaries of your profession according to your local regulating professional body. But then perhaps on a more spiritual level, I think it would be very helpful to understand what is it that the Lord wants from you. And actually, for me, certainly trusting the Lord in how I'm going to run my practice, trusting the Lord for who will be coming to me for a service, and also trusting the Lord for discernment and the skill needed to really help people. So I think having a sense of what your personal interests and skills and gifting is, and really also to prepare yourself for who you believe the client profile will be that you will serve. Obviously there's all the practice management and organizational skills that you will need to put in place. But I think that would be my high-level advice. How do you separate fads from evidence-based practice? How can research inform treatment planning? And what is the role of supervision in ensuring integrity? Well, first of all, how to separate fads from evidence-based practice is to look for the evidence for whatever it is that you are seeking to treat or to assist with. So, and also being aware of levels of evidence. So certainly systematic reviews and meta-analyses would be the highest level of evidence to inform you on the efficacy of a certain intervention for a certain diagnosis. So whether it is gender dysphoria or a mood disorder or autism spectrum disorder, clearly as a practitioner, as a clinician in wanting to help people, I need to be aware of what does the best evidence say is helpful in the management of someone with this condition. How can research inform treatment planning? Well, following from what I just said, if I know, obviously systematic reviews or meta-analyses, they give a population-based evidence for efficacy. So giving me an impression of, in the majority of clients with this condition, this intervention has proven to be useful, but obviously acknowledging that it's not necessarily going to be effective at each individual client. So the guidelines, the evidence-based guidelines, will inform my approach and the options that I would start with. But obviously I need to be flexible if those options do not appear to be helpful to the client. The role of supervision, I think it's very important. Often there are also professional bodies provide ongoing training. Your profession might have continuous professional development requirements, but especially when providing therapy, it's very important to have some form of supervision. At the moment, I want to learn more about therapeutic interventions, so I need to find myself a therapeutic supervisor just to help me check how I'm doing and if I'm helping clients appropriately. How do social, cultural and or geopolitical factors impact your clinical practice? Well, in South Africa and Cape Town, we certainly are quite westernized, and Western ideologies and ways of doing things definitely have infiltrated into our context. And they do also affect the popular opinion about certain interventions, certain forms of therapy, certain ideas about mental health and also sexual identity. And certainly prominent, for example, psychological associations might be influenced by certain ideologies about sexual and gender identity. And that definitely impacts on how academics and clinicians in our setting view certain interventions. So for example, there might be a very narrow view of only gender and gay affirming therapies being evidence-based and being good, and anything else, anything more neutral and explorative might be seen as unethical in an incorrect way. So I think that's maybe one way how geopolitical factors influence what is deemed to be acceptable and not in our setting. Of course, the socio-cultural context of each client has a huge impact on how they see their own mental health and the problem that they're coming to you with, and that inevitably you have to factor that in when contemplating your assessment, but also your management plan.